Well, this season is going to be probably a little more severe and a little longer because we've had this peculiar warm winter and things have started to blossom until 2 weeks ago when we got a little bit of rain, put things on hold. But some people who've never had allergies are going to start to experience the itching eyes and sneezing. And if they just have a bad couple of weeks or a month, they'll get through it. But others, they will find that their general feeling of congestion and sneezing and runny nose or sinus pressure is now suddenly getting worse. And so this is a season that confirms for them that what's happening is really allergy. It's not just something around or just the way they've always been. So when their general symptoms of sinus trouble or asthma starts to really be aggravated this time of year, it's a wake-up call that, maybe the allergies is an underlying cause. Most people know that one over-the-counter antihistamine or another or some of the eye drops will get them by. But others, they've been doing that and now the medication is no longer effective or only gives them partial relief. So they need more than that. And that's when they need to see an allergist because there are some prescription medications that can work. But more importantly, from my standpoint, is the people that have been used to having this every year or 3 or 5, it's time to think about finding the underlying cause of their allergies, get some testing, because once we put them on immunotherapy or allergy shots, we can make it all go away. I mean, allergy is truly a curable disease if they use immunotherapy. Oh, immunotherapy is the long doctor word for allergy shots. It's pretty simple. And allergy shots are voodoo that we've been doing for 100 years, where we mix up a little bit of dust or cat or pollen and give them tiny, tiny little homeopathic doses, and it counteracts the allergy inside them and makes their symptoms disappear. It's not artificial, it's not synthetic, it's normal, natural things from the environment that you're used to being into, and it's given under safe ways that of course are sterile and FDA approved. And there are hundreds of double-blind studies that show that allergy immunotherapy is the only treatment that will cure chronic sinusitis or asthma, and now we know also chronic middle ear disease. People understand allergy shots. You come in, you get a tiny little thing like your TB shot. It's not a shot that hurts the way penicillin used to when we gave something deep in the arm or in your backside. It's a tiny little shot like a mosquito bite, and no worse than that, once a week. And for little children or some people who are afraid of needles, we use the same material and just put drops under their tongue. It's absorbed, and that's been proven again to be very effective, almost as effective as the shots, and it makes the allergies disappear. The precautions one should think about, if you know that every time you visit grandma and the cat sits on your lap and you sneeze or have your asthma attack, it's time to invite her to your house where there are no cats. And the joke is you'll never get the cat out of the house, they'll get the doctor out of the house first. But you can make sure the cat doesn't get in the bedroom. You can be sure you wash your hands after you pet the dog, because otherwise you rub your eyes and they start to itch. People understand that. And it depends on how severe your reaction is. Sometimes you can sit around and be okay for the evening and take an antihistamine before you go visit. But other people know they walk in the house, their asthma triggers, their nose starts to run like a faucet. They just have to leave. It's survival, fight or flight. And some people's allergies are that bad. And that's another indicator that it's time to get tested, get under true allergy immunotherapy rather than just mask the symptoms with another antihistamine, and alter the immune system so your body stops reacting. the medicine covers up the problem, but it doesn't change your system. Only the allergy shots or the immunotherapy will change your system so it really goes away. Well, you've asked two questions. Each pollen is different. There's some cross-reactivity, so most of the grasses, you don't have to test for all 10 grasses. You can treat for 2 and cover all of them. You can treat for 3 or 4 trees and cover most of them. Although certainly the trees like juniper out west or sagebrush is different than some of the pollen that we have here. So you have to cover a few of them. That's one part of your question. The other is it curable? And cure is an interesting word and not often used in medicine. But allergies can be cured by allergy immunotherapy. And there are hundreds of studies that prove that. Children are one group where sometimes they often just get one infection after another. And if the fluid persists and they need tubes, especially more than once, then that for sure is allergy. But we've had adults that come in and they've never had ear trouble, really, for decades. And they may come in their 30s or 50s and suddenly they've developed fluid in even just one ear, not both. And it persists for 3 months or 6 months with hearing loss. And you know how annoying it is when you get water in your ear swimming, except you can't shake it out. It's on the wrong side of the eardrum. And that fluid, unless there's some rare instances of other problems that can cause that, and all ear, nose, and throat doctors will know how to make sure that that's not the issue. But if otherwise they have to put a tube in to drain the fluid out, then almost always that is from allergies. And we've proven that and published it. And those adults come in and they've had 1 set or 3 sets of tubes. We find out what their allergies are. We treat them exactly the same way. 80% of them also, by the way, as you start to get their history, have some chronic runny nose or itchy eyes. And maybe 20% of them have some asthma that was unrelated, not acting up at the same time. And now they've added their ear fluid. So you treat their allergies and the ear fluid doesn't recur. Whereas if you don't treat their allergies, once the tubes fall out, the adults experience the same thing, that the ear fluid recurs. And that's very debilitating. And I have a number of, stories of one adult or another who've experienced that. I had one gentleman come in, he was a professional musician. Not only did he play, but he also managed the Ouija board where you adjust the tone. And his ears would fill up with fluid, and musicians drive ear doctors crazy because they're very attuned to what they're hearing, and the slightest change, that's their instrument. They can tell they're not up to par. And he could tell a few decibels worth of change in his hearing, and it would affect his performance. And so we treated him. His ears would stay clear. And he brought me a DVD of a performance he did at a theater in Europe. And one track was when his allergy shots had worn off and he couldn't modulate his voice the way he wanted. And the other track, even I could tell, was clear and on pitch. And so it's important. I've been invited to do some review articles for the clinics of North America for this. One is for Current Opinion in Otolaryngology. Over the years, sort of an update of what the thinking and finding is. So the medical profession is beginning to at least recognize that this is a true entity, that allergies really do cause chronic middle ear disease. And, my articles have been quoted, and now there's new articles coming out recently, last May, in Allergy, which is the big journal in Europe on allergies. And it was an article on using nasal steroids such as Flonase or Nasonex or Veramist for the treatment of chronic middle ear disease, with the idea that if you can get the steroid up the nose and reduce the swelling in the eustachian tube, that might work. And they used the same science and quoted our same articles that show that chronic middle ear disease is an allergic disease. So the same medicines we're using for chronic sinusitis or chronic runny noses should also work for the middle ear if they can get it up the eustachian tube. But the problem is they can't. So that leaves them with, they didn't go that far, but that really leaves them with the only thing they can do for chronic fluid in the ear is to treat their allergies with immunotherapy.